infield wise. You see how that wants to just slingshot back to me?
Yeah.
Hard. And then over here, you got a muscular infield.
Softer.
And it's a lot softer. There's not that.
Yeah.
Okay, so this is a normal infield and external rotation muscular. This is definitely a capsular infield, and it's just like wham, it just wants to go. So,
Slingshot.
yeah, and do you feel pain posteriorly when we get you out to end range, external rotation?
A touch.
Okay. So if we test, hold there, elbows in tight, don't let me move you. Solid, 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 solid. Feel the differential? Okay, it's exactly the same presentation as that dude.
Yeah, that's exactly what
let's get you on your back, your feet down here. So he was 27. How old are you?
27.
Huh, same age too. Okay. Oh my God, to be 27
Ready,
again.
you know, a couple little case series on us.
Stay as relaxed as you can. We'll just do it. So we're gonna be, there it goes. Feel that relocation? Okay. So you're just sitting a little anterior and inferior. So we're gonna hang you out there. We'll stretch out the posterior capsule a little bit. Did I do this for you once when you were a student or no?
We did a subscap release.
Okay. We might do another one here in a minute. So super simple, and when we do the glide, remember the glenoid is at that angle about 30 to 45 degrees relative to the frontal plane. So that's why I usually sit on the patient and push in the plane of the joint, because if you're here and you're just going straight down, your glenoid is actually angled up this way. So unless I'm perpendicular to the joint plane, I'm not going to be really effective at gliding that joint. There. Feel that move? Okay. The sound is great. The sound is fun. And nobody hears him pass gas. It's perfect.
I haven't had the breakfast burrito.
Oh, dude, it's so good. Mine's still sitting up there on that pile of weights. It's my breakfast, man. Okay, so super relaxed. And if we just take you back now, after just a capsular stretch, a little different? Yeah. So let's see if it's just your capsule or if it's subscap. Come on up to standing. If you're already testing stronger, there's nothing wrong with subscap. It's just capsule, and you just need to go after your sleeper stretch a ton. So elbows in tight, same test position, hold, and that's already way better. How's it feel?
Feels good.
So try overhead stuff. Did I ever show you, Mark, could I have a PVC pipe, please? Thank you. Awesome. Did you ever do
Passovers? Oh, okay.
that stretch? Just passive external rotation. You know, that's a really nice one. There you go. And yeah, just bring this out a little bit and you just pull this hand forward and hold on to it. Then I usually like to keep the humerus in this scapular plane. So, no, you had it right. There you go. There you go.
Yeah, it's way more comfortable out here.
Nah, that's terrible. Yeah, scapular plane only. And then you can try your overhead lockout position.
Feels like it's stretching around the inferior, inferior lateral.
So you need to stretch your lat because your lat attaches to the medial lip of the bicipital groove. It's a medial rotator. So if you stretch your lat, okay, humerus and external rotation right up against the wall, get some nice length to your lat. Decrease the amount that your humerus internally rotates, okay? Do your sleeper stretch to stretch your posterior capsule. Make sure levator and upper trap are nicely stretched. You will help inferiorly and posteriorly seat your humeral head a little bit more efficiently. And then I would probably add a little bit of scapular depression work. So kind of like we worked on yesterday with that gentleman. I don't know if you were there while I was trying to teach him this. So lots of scapular depression work, and your humeral head will sit a little bit more inferiorly and you won't get that sensation. So try it out now. Hang on there for me, don't let me move it. That's way better. Ah, can't move you now. It's perfect.
It's a little twinge.
Okay, so try your, let's just leave it there so I don't have to keep, try a sleeper stretch and then we'll test again. I'm a miserable perfectionist, sorry.
Me too.
It's good. So you got to get your scapula right up on its edge underneath. If this is still free to move, then it's going to be totally ineffective. So very gently take this hand, put it here, and just bring it down until you feel that tightness start to wind up. And what you'll notice, stay here. If we let your scapula move, there's no more stretch.
Yeah.
So your scapula's got to be, this scapula's got to be up on its far edge, locked against the table. So the only rotation you're getting is, yeah, the humeral rotation is all you want. You don't want any upward rotation at all of your scapula. And you'll feel a distinctive tightness right there, right in that posterolateral corner. And you can do, if you want, you can do a little contract relax here. So try to externally rotate, but don't let it move. And then when you relax this arm, sink down a little bit further.
That's what I'm trying to do.
Yeah, it's perfect.
Is it more of a capsular stretch or the tendon that you're stretching?
You're probably getting a little bit of teres, a little bit of infraspinatus, but if the slingshot effect is still there, so like if you let go and your hand wants to slingshot back up, that's capsule.
1 minute, Sarah.